Welcome to the Vintage Times, a program for older persons. On our program today, we will talk about bladder and pelvic health. Many people would like to have more information about bladder control, but are embarrassed to ask. The lack of bladder control or urinary incontinence is a serious problem that can limit our daily activities and can negatively affect our lifestyle. The good news is that it's treatable. There are simple and effective treatment methods available. Today we will talk about bladder and pelvic health with Christine Cornell. Christine is a master trainer at the Advocate Good Samaritan Hospital Wellness Center, and she teaches a class called Total Control. Christine knows a lot about bladder health and pelvic health. This program will be a two-segment program. Today we will talk about general aspects of pelvic and bladder health. And next month, we will talk about the variety of treatment options. Thank you, Christine, for joining us today. And can you briefly describe what you do, what your profession is?
Sure. So I'm a group exercise instructor at the Wellness Center. I'm the coordinator for all of our group exercise programs, a personal trainer. I've been teaching in DuPage County for the past 24 years. And my passion is talking about bladder and pelvic health.
What is bladder and pelvic health? Can you describe
Sure.
it?
Well, when we think about pelvic health and some of the things that can go wrong, for some people, they just notice that they have problems with their balance, okay? And that could be that there's a problem with the muscles that support the pelvic area. Some people have prolapse with some of their organs. They might have heard from their doctor, well, your bladder's moved a little bit, okay? Some people have pelvic pain. So that's when we're talking about pelvic health. When we talk about bladder health, many people think about incontinence, urinary incontinence. But we also want to think about fecal incontinence, gas, and there are different types of incontinence.
Okay. Can you describe to us in simple words how the bladder works?
Sure. And I'm going to give you a little demonstration. So, how the bladder works, just think about it like a constant conversation between your brain and your bladder, okay? And we talk about this and we say that maybe you have a couple drops of water, and that's even more than you would have, about 6 drops a minute. And that goes on all day, all right, and into the evening. And your bladder starts filling up, and it tells your brain that it's time to go to the bathroom. And it's your job to let the bladder fill correctly and not constantly run to the bathroom. So your bladder can hold about 2 cups of urine.
2 cups?
2 cups. And this is not even 2 cups, right? But every time your bladder starts filling more, it says to the brain, I got to go to the bathroom. And your brain is supposed to say it's time to wait, because the normal amount of voiding is about once every 3 to 4 hours. And during the nighttime, it's about 0 to 1 times. So it's our job to try to retrain the bladder if we're running to the bathroom every 20 minutes or every hour. So it keeps filling up, and you have to keep saying, nope, it's time for me to go balance my checkbook or do my grocery list, something else. And this isn't even 2 cups.
No.
But when the bladder gets closer to really filling at about 2 cups, then you can go ahead and void. If you constantly run to the bathroom, your bladder is going to keep having that conversation. It's going to keep saying it's time to go to the bathroom. So you can have more control over your bladder.
Yeah, so it's a conversation between your brain and your bladder, and your brain has to tell your bladder, wait. Yeah.
Wait a little bit. Correct.
Yeah, wait. Okay. Interesting. What causes urinary incontinence?
Well, for some people, it's maybe they had surgery and they could have nerve damage. We could have cut through some of the muscles that support the pelvic structure may not be strong enough to hold it in the right position. And this is like a bowl almost, your pelvic area, and it's holding up lots of different organs, your bladder, your rectum, your uterus if you're a woman. And men and women, by the way, have this problem. It's more prevalent in women, but men also have organs that their pelvic area is holding up. Okay, so if I talk about it like a puzzle, and if you think of those trays that have puzzles, if we remove a piece, we know that those puzzled pieces move around. So if someone had a hysterectomy, that could cause problems for them down the road with incontinence. Or maybe the supporting structure, the muscles, the ligaments, the tendons, have weakened with age, and it's pulling down. Or childbirth is another reason why things get weak through there. And so that can cause incontinence.
So there's a certain imbalance that may cause it due to many different factors.
Sure.
Now, you said, does it affect both women and men?
Yes, it does. There are lots of different statistics. Some statistics say that 1 in 3 women deal with bladder and pelvic health problems. We see that in young women, athletes, 18 to 21 years old struggle with this problem, new moms. So here you have a daughter who goes to the hospital, she's delivering her baby, and she's thrilled about having her baby, but all of a sudden she's having terrible problems with incontinence. And nobody talks about that.
Right.
Or as you get older, women, I'd say the statistic is about 40 to 50% of women 60 and older have this problem. Now, men don't have the same problem. You don't see it as frequently, but as they get older and they're having problems with their prostate, or they've had surgeries, some people have hip replacements, and if we cut through nerves, muscles, anything like that, they can end up also having problems.
It's interesting how so many things in our body are interconnected and can affect each other.
Sure.
So you said people don't like to talk about it. It's a silent type of...
Sure. I think people are hesitant to talk about it, partly because there's this stigma attached to incontinence. If 1 in 3 women had a problem with heart disease, we would talk about it. But the heart is here. There's no smell associated with it. There's no
shame.
Negative. Correct. The other thing is that as we get older, we're told not to talk about from here to here. And it depends on the generation.
Right.
But my generation, my mother's generation, my grandmother's generation, we would never talk about this in public. Right. And we need to talk about it.
It's what we're doing today.
Yeah.
We don't want this to be a silent problem. We want you to talk about it.
Well, and I would say the other reason why we need to talk about it is because we're seeing the statistics are showing that this is becoming an even greater problem, because it's also tied to obesity, which is on the rise, and diabetes. So people who are obese or have diabetes are at a greater risk of having problems with incontinence.
That's important to know. Does aging affect urinary incontinence?
Definitely. Structurally, things have to be supported. And so once again, if ligaments, tendons, muscle, if that's doesn't have the same strength, that's one thing. The other thing is that estrogen levels can impact this situation. Right. So especially in women, as we get older and we have a change there, that can affect it.
Many reasons. Now, are there different types of incontinence?
Yes, good question. So you might have seen a commercial where someone said, I gotta go right now. Okay. So that's often referred to as overactive bladder or urge incontinence. You drove home, you got out of the car, you put the key in the door, and all of a sudden you had to go.
Right,
okay?
right.
You put your hands in the water and you gotta go.
Right.
Okay. So that's urge or overactive bladder. Another form of incontinence is called stress incontinence. So you cough, laugh, sneeze, you exercise. you pick up something heavy. Maybe you're picking up a grandchild, okay? That could be, and you lose a little bit of urine. That's stress incontinence.
I see.
And then many people deal with a mixture of those two.
Okay.
And that's called mixed incontinence.
Mixed. So how do I know which type I have?
Well, one of the things you can do is monitor it. You can keep a kind of a journal. Write down how often it's happening, when it's happening. Does it happen frequently during the day? Are you getting up 3 to 5 times during the night? When you go outside and then you come in, do all of a sudden you have to go to the bathroom? And as you start documenting that, you're going to see some type of a pattern perhaps. Is it after you drink a cup of coffee in the morning or a certain kind of juice? And you monitor that, and then you need to have a conversation with your doctor about it.
Right. Now, many older people complain that they have to get up at night several times. What are the risks involved in that?
Well, first of all, and it's hard for people to hear this, but getting up during the night frequently is common. Many people do it. But it's not normal functioning for the body.
Okay.
Really, the idea would be for you to get up 0 to 1 times during the night. And the reason why is we want you to have a good night's sleep. We don't want it to be interrupted. It's dark when you get up, and you may have a tendency to trip, to fall, because you don't know where, you don't see where you're going.
Don't see.
Also, people have a tendency to rush to get to the bathroom.
Right.
And so that's why it's better for us to try to cut down on those visits to the bathroom in the evening.
I've heard that sometimes it can cause falls because the floor can get wet and people trip and slip on the floor.
Exactly. Yeah. So when people go into the emergency room, if they've fallen, there's so many questions that they're being asked. They may not be asked, why did you fall? It could have been that you were rushing to get to the bathroom, and then you lost your bladder. You had urine on the ground.
So falling is one bad impact. What other impacts does urinary incontinence have?
Sure. Well, I think that one of the most important ones is to recognize that it changes your life. We talked earlier about the stigma. People can get very depressed. They can feel isolated. They're no longer comfortable going on family outings because they don't know where's going to be the next bathroom for them. They're not sure if they're going to lose their bladder and be embarrassed by that. And so what happens is they start pulling back. They don't go on those outings. They stop exercising as much. There are some people who are afraid to even get to the doctor's office because they don't know if they're going to make it to the doctor.
Well, of course. So it has serious effects on your everyday life. It can cause probably loneliness, depression if you stay at home because you're afraid to leave home.
Sure.
It is a serious problem and not necessary because it can be treated.
Yes.
Right.
Yes.
Right. So you mentioned all kinds of factors that can affect urinary incontinence. Can constipation affect the urinary incontinence?
Yes. So constipation, if you're bearing down when you go to the bathroom, that's putting a lot of pressure on your pelvic floor. So when we talk about pelvic health, we need to remember that we have muscles in the front of our body, in the back of our body, and then what we call the pelvic floor, kind of like a hammock underneath your body.
Right.
Okay. And if you go, if you're constipated, you're going to bear down, and that's a lot of pressure through here. All right. So we really encourage people to get plenty of fiber, and along with fiber, you need to make sure you drink water, because if you don't, you're probably going to be gassy and people might not want to be around you.
Yeah, right. There's so many little things we can do to help the problem. Our older people, you mentioned before a generational problem. Are older people especially embarrassed about talking about it?
I think they're not necessarily embarrassed about talking about it with a friend. They can laugh and say, oh yeah, we're older, and gee, that happens. And But I do think that they're hesitant to talk about the body parts because they were told when they were growing up, you don't wear a pair of pants that brings attention to this part of your body. You don't say the words for the openings in your pelvic floor,
Right.
which men have 2 openings and women have 3. We both have a urethra. That's where the urine comes out. We both have an anus, and that's where we're going to have our fecal matter coming out. And then women have a vagina.
Right.
And we need to be able to say those
say
words.
that.
Because when you go to talk to the doctor, you don't want to go to the doctor and say, I have a problem down here.
Right.
He's going to say, what is the problem?
Yeah.
Can you explain it to me? So you really want to practice that. And we do that in our class that we teach.
So you mentioned the doctor. How do I prepare for a doctor visit? What do I ask? What do I tell him or her?
Okay. Well, first of all, I recommend that people try to keep some sort of record. Write down how frequently it's happening. As we described earlier, the type of incontinence. Are you sneezing and you lose urine? Or is it that I pull up in the driveway and I have to go? So write those things down and then make sure you're making an appointment. Start with your primary care physician.
Okay.
That person knows your history. He or she knows what medications you're taking, what surgeries you may have had. Those things can put you more at risk for incontinence. You go in, you talk to your doctor, you explain what's going on, and talk to him about how it's impacting the quality of your life. Your primary care doctor can do an exam. Your primary care doctor might suggest a medication. They might suggest instead try to do some exercises. We want to strengthen the muscles down there that support these organs. The primary care physician might suggest you see a specialist. There are different types of specialists. Frequently, men see a urologist. Men or women can see a urologist. Many women see a urogynecologist.
I see.
It's a newer specialist in this field. And you go and you see the specialist, you talk to that person. That person, once again, might be examining you and deciding a medication might help. Surgery might be a requirement. For some people, surgery is not an option. So if they can't have surgery, there are non-medical interventions. There's a device called a pessary you can be fitted for that'll help support your organs. And then maybe your specialist might suggest you see a pelvic floor physical therapist.
I see.
And this is true for men and women. So we have a lot of men who come to our wellness center who've had prostate cancer.
That affects it.
That affects it, right. And there are physical therapists who are trained to work with men and women on this and to help strengthen the muscles and to help you take control of the problem.
That's very helpful. So our first step is to go to a primary physician. Because some people might say, I'm going to a urologist right away.
I would suggest that you have the conversation with your primary care physician first. Once again, because they know your history. And they may have a doctor that they can refer you to. And they might be able to make that call to the doctor. Some specialists, it takes a while to get into. It's a good place to start. If you have a specialist that you already have a relationship with, you can go there.
Okay. And make yourself a list of questions. Prepare ahead of time. Should you have a log or something in writing that can indicate the type of incontinence you have?
I think so. And you need to be prepared when you go to see that doctor. They may send ahead a 2 or 3 page questionnaire for you, or you might show up in the office and all of a sudden you need to write down, have you ever had any surgery in this area of your body? What medications are you on? Do you have a family history of this? Lots of questions that you might not have the answers for if you haven't kind of done that work ahead of time.
So think ahead, plan ahead. Now, we talked about people who already have a problem. Is there a way to prevent, to treat yourself so you will not have the urinary incontinence?
Sure, good question. So yes, there are ways to do that. I would say that we talked a lot about incontinence. We didn't talk about the people who don't have to go to the bathroom all day.
Right.
We call them kind of like a camel. They go a long time without. And those people can also have problems. It's called overflow incontinence. That bladder has stopped having the conversation with the brain, and all of a sudden they may lose some urine because the bladder is filled so much. So I just want to mention that as well. But what you can do, you can change some of your habits. If you're someone who drinks a lot of carbonated beverages, artificial sweeteners are a bladder irritant. If you don't drink enough water, that can cause a problem. Your urine becomes so concentrated in your bladder that it keeps saying, we got to get rid of this, and it keeps sending you to the bathroom.
That's interesting, because some people don't drink in order to prevent from going to the bathroom. So that's a mistake.
It can be, right.
Yeah.
And not every person has to drink a certain amount of liquids. It's not, you don't have to drink 8 ounces and I have to drink 8 ounces. It's really going to depend on how active you are. But I speak with many older people, they've kind of lost that thirst, and they might drink a cup of coffee, they might have a glass of water, they might have a glass of alcohol at the end of the day, a glass of wine they've heard is good for them.
Right.
Well, alcohol is also a bladder irritant. 3 cups of liquid is not good for your bladder. It will probably have the opposite effect of what you want. Okay. So we can't just limit our liquid intake. But you can also modify some of the things you're doing. You see a physician. We teach a class at the Wellness Center. It was developed through the Women's Health Foundation. And it talks to you about other things you can do. Taking time when you go to the bathroom, sitting down and relaxing, reading more about bladder and pelvic health, so you understand how everything works. There's lots of steps you can take to take control over this issue.
That's very, very encouraging. This is so very, very interesting. Christine, is there anything else of importance you'd like to add?
I think that you want to continue to talk with people. Your doctor, come to a community-based class. Then you know you're not alone.
Okay.
The Wellness Center, we have a class. We will review a book we use. It's called You Go Girl, but Only When You Want To. It's a wonderful book.
Yes, I read it. It's good.
We talk about things like incontinence products. Okay, so these are pads. Most people use the wrong type of incontinence product. Most women go in the store, they buy something called a light day, a liner, and this is designed more for like a menstrual pad to absorb blood, which is thicker and doesn't have the same smell as urine. This is an incontinence pad on my left here, okay? Looks very similar to the other one. It's not thick. Okay, it's not like you're going to be riding a horse a saddle all day. And this is going to absorb the urine. It's going to pull it away from this delicate tissue so you don't get burned basically down here from the urine.
Very good.
It's going to pull it away, and it's going to do the job that you want this to do, but it's not. That's not designed to do it.
That's important to know. And you will give me, if I come to your center, you will give me a kit that may have this and other information. Is that right?
Yes, and I forgot to say that. So come to the Wellness Center. We're going to put my phone number, I think, at the end of this segment. Call. We'd love to have you come and observe a class. We'll give you a packet that has information on exercises you can do and some of those bladder health tips I mentioned.
Good. Well, thank you very much for joining us today. We hope you learned a lot about the importance of talking about bladder incontinence or any other pelvic issues you think you may have. We also want to be sure that you watch next month's program where we'll talk about methods of treatment such as exercise, lifestyle changes, and more. If you would like to contact Christine Cornell, her phone number is 630-275-2283. And remember, if you go to the Wellness Center, you can get a kit with information and a few products. Or if you have questions, you can also call us at the Township at 630-719-6682. Thank you for joining us today, and watch us again next month.